Hi out there. Welcome to this evening's presentation on writing about experiences for health professions. I'm Dr. Amanda Dye. I'm the Director of Advising and Programs at Beyond Barnard and the Health Professions Advisor. And this is the last in our series of writing events and the next to last of our spring events for preparing for the summer application cycle for health professions programs. So thanks for being here or viewing the recording as you are getting ready for your application cycle. As usual, I've got a presentation, so I'm going to go through it and save some time at the end for questions. So without any further ado, the things that I want to talk about today are specific to the experiences or work and activities section of a health professions application. Health professions programs tend to use centralized application services that will ask you to present information in a particular format. And so I want to talk about sort of understanding how to use that section to your greatest advantage, and give you some tips on how to present yourself and your experiences in a way that that will be as sort of legible and interesting as possible to your application reviewers. I have a section at the end for some practice, and depending on how much time we have, we may do a couple of examples so that I can sort of show you what I mean as I'm talking through the first part of the presentation. So pretty simple agenda. We'll talk a little bit about how to get started, tips for actually constructing your writing about experiences. We'll workshop a few examples, and then I'll wrap it up with some final thoughts. So in terms of getting started with the experiences section, as I said, centralized application services typically are going to ask you to present information about your application in a very specific format. They do not typically accept or even solicit resumes or CVs. So you're not necessarily going to be presenting this information in a way that you might for, let's say, a job application. These sections, which are sort of called different things, I tend to just use the term experiences. In the AMCAS application, it's called work and activities. Don't ask me why. But these sections of applications allow you to present some of the information that you might have put on a resume, but with a particular kind of twist. So number one, you're going to be asked to provide specific information about like start and end dates and, titles of experiences. You're going to be asked to classify experiences. So you'll give a bunch of kind of contextual information, and then you're going to be given a space to write some prose about each of your experiences. In AMCAS, this is 700 characters. In other application systems, like ACOMAS for DO schools and ADIA ADSAS for dental schools, usually it is a 600 character limit. In the AMCAS application, you also do have the possibility to designate up to 3 activities as most meaningful, and that gives you some additional space to write reflections about each of those. I'll talk a little bit about that later. Some application services do limit the number of entries that you can make. AMCAS in particular limits you to up to 15 activities, so 15 entries in this section. Other application services, ACOMAS, ADIA ADSAS, actually are more flexible and don't necessarily have a limit on the number of things that you can list. Their sort of similar sections of the application are just set up a little differently. All of the application services will provide you a list of preset categories to choose from. They have, as you might imagine, pretty similar kinds of category labels, but they're, the exact list is different from service to service. So you're going to be asked to, for each of your experiences, to choose the label that best fits that experience. And we'll talk a little bit more about that as well. Why this section is important is because it's a way for professional programs to understand how you have been spending your time as an applicant. They want to know if the things that you say you're committed to are aligning with the goals that you're presenting. So if you're talking about, a particular kind of interest that you have within the health professions field, say in your personal statement, it should be backed up by experiences, right? So if I'm a person who's writing a statement about how my goal in my professional life is to work with a particular urban community, then having previous experience working with that community or communities like that one, that can be really helpful for an admissions counselor to understand, like, okay, yeah, this is a person who's already kind of gotten started, moving toward goals. There's no expectation that you've become a doctor or a dentist yet, obviously, but there's the expectation that the things that you are saying you want to do in the future, you've started exploring to some degree. Like the personal statement, the experiences section really does let admissions officers know what's important to you. It just presents this information in a different and more directed way than your essay. So if you have watched any of my presentations on personal statement writing or come to talk to me about the personal statement, you will have heard me say that the personal statement is a snapshot of a kind. It is a sort of particular perspective on you, the candidate. It's not possible in the personal statement to be comprehensive, but you can get a lot closer to comprehensive in terms of describing your experiences in the experiences section. So your personal statement is not necessarily a place for information, but this section is. So just a reminder, again, for those who have seen a slide like this in one of my previous presentations, the personal statement is much more about narrative and understanding who you are, your perspective, your reflection on kind of your sum total of experiences, whereas the work and activities section is the workhorse. Like, it's the place where you're informing the reader about how you spent your time. It's the best place to provide details that are specific to an activity, and a place to make sure that you're highlighting your accomplishments. And so that's what we're going to talk about today. So when you're choosing experiences to put into this list, I think it's important to consider both how they represent, the breadth of your experiences, right? So are you kind of covering the bases in terms of the things that are interesting to you or the things that you've spent a lot of time on? And are you kind of expressing kind of the range of things that are of particular importance to you? But your experience list is also a place to demonstrate, particular levels of commitment to certain experiences. So having a mix of activities with different levels of commitment is, I say okay here, but it's natural. It happens, right? Nobody can be doing every single thing on a list of 15 things every moment of their preparation for this application. So that's not the expectation. But a successful applicant is likely to be somebody who has some experiences that have a long-term engagement, over a year, and others that are shorter term, but still meaningful in their own way. You also want to think about the hours per week that you've spent on a particular engagement, because you'll need to describe kind of your hours of engagement with this particular experience as a whole, like within the time frame. And so it's good to make sure that you're showing a mix of, like, some things where the commitment was more intensive at particular times, and maybe some where it's a regular commitment, it's just not a huge chunk of time. When you're classifying experiences, like I mentioned before, the service is going to give you a list of predetermined categories. In AMCAS, there are probably a couple dozen different categories, and it is very, very common and not a problem for activities to fit into more than one category. If you are in that situation where, like, let's say you were the president of a community service organization on campus, that could fall potentially under a service category, but it could also fall under leadership. I would encourage you to think about, kind of what the experience meant to you, how you're trying to frame it for application reviewers, what the largest chunk of your time commitment to that experience looked like, so that you're able to kind of classify it according to best fit. And then you can use the prose space, the space that you have to describe the experience, to clarify anything that's not necessarily captured by the category label. Similarly, if you think that there's kind of an ambiguity about the kinds of category, or there's an experience that you think is really kind of a coin flip in terms of how much time was spent on one part versus another, I would say do your best. You have to pick a category ultimately, but make sure that you're making your responsibilities or outcomes of your actions clear in the description, even if the category label isn't necessarily the most perfect fit. When you're calculating hours, when you're sort of, giving an estimate of your commitment to each of these activities, you should Be honest, of course, and try to be careful in calculating or at least estimating. If you are, writing about an experience that you have, say, pay stubs for, it's pretty easy to go back and calculate the number of hours. But if it's, let's say, a volunteer experience that you did about 40 weeks a year and about 4 hours a week, then you're estimating about 160 hours for that year, essentially. So doing the math, judiciously is important. If there looks like a sort of, let's say you provide an activity that happens over a particular period of time and you have a really huge number of hours associated with that, an admissions person could calculate your hours per week based on the data that you've provided and kind of ask themselves, is this reasonable? So if you think it might look strange, or someone might not understand how much of a commitment you had to a particular activity, you can point to the intensiveness of the experience, but don't overestimate, is what I'm saying. Kind of make sure that the number of hours that you're providing makes sense within the time frame that you've given. Some application services, particularly AMCAS, will allow you to specify multiple date ranges, and this can be really helpful if your involvement has been non-continuous, or let's say your involvement has varied with time. So maybe you did a summer research experience and you were in the lab 40 hours a week over the summer. You continued in the same lab over the academic year, but only 10 hours a week. You can really easily show the difference there. Or say you were in a summer research lab and then came back the next summer, but you weren't there in the intervening academic year. You can make that clear very, very easily. If you are not able to do this, you can also use the pros section, the description section, to clarify hours. So if your application service doesn't allow you to specify the multiple date ranges, you can just kind of clarify what the commitment looked like at various points of your experience. In terms of creating this list of experiences, one of the most common questions is, how many do I need to have? I would say, in my experience, most successful applicants will have upwards of 10 or 11 entries, but it's better to list fewer than 15 than to stretch. I mean, the difference between 14 and 15 is probably not huge. So I would say, rather than kind of trying to separate experiences in a sort of artificial way, having, 11, 12 entries rather than 13 or 14 is completely reasonable. It's often also the case that folks, especially folks who have spent some time, after graduation, haven't applied directly to professional programs, you just have a lot of experiences and maybe don't have enough room within that list of 15. So I always encourage folks to consider grouping experiences wherever possible. I recommend this in particular for experience types like shadowing. Typically, shadowing is a pretty short-term experience. Now, that's not always going to be the case, and if there is a shadowing experience that you think really needs to stand alone, this is all, that's within your purview for sure. But places that I find that people can often save a little room is, grouping things like shadowing experiences, awards, hobbies, publications. These are all places where you can kind of put things together to indicate, kind of the breadth of your experience within that category. You can also group related experiences together. So publication and research are typically separate category labels, but obviously research and publication are pretty intimately related. So if you didn't have enough room to have a separate publication entry, you could still mention a publication or multiple publications in the entry where you describe your research. If you have work experiences, particularly if you've worked to support yourself or your family, please include your jobs. Professional schools really do value seeing applicants who can balance varying demands, and they need to know that you've been spending, a particular part of your time working to support yourself or your family. Here, I would say that relevance to your career field is not a primary concern, right? Like if it's an office job, if it's a job in the service industry, if it's babysitting, all of these things are still, these are places where you've been able to develop skills that are going to be transferable to healthcare in some way. Interpersonal skills, super important for health professions and very important for a lot of kinds of jobs as well. Just making sure that, you're helping schools to understand the demands on your time so that they can contextualize, your other accomplishments, right? So that they can see that, hey, maybe this candidate had a little bit less time for this activity because they were spending a pretty significant amount of time working. That sort of thing is very, very important to include. If you've had experiences outside the US, those are absolutely valid. Those are definitely things that you can include. I would just say consider how you're framing your remarks, especially if they're healthcare related experiences. Sometimes it can be easy for people to think about experiences outside of the US as a little bit more like magical or special, partially because you've traveled, or I don't know, lots of different reasons. But if you're talking about an experience as a transformative one, I think you want to be sure that you're able to demonstrate how you transformed and what's different about your subsequent activities. I think it's also important to remember, especially if you have clinical experiences abroad, that there are pretty robust guidelines on how pre-health students from the US should be interacting with patient care abroad. There's a link here, and I'll share the slides with everyone. But I would say definitely making sure that you're not including any content in a description of these experiences that would be outside of those guidelines. It's definitely the case that in some places around the world, standards are different in terms of who can do what in relation to a patient. And so you want to make sure that you are presenting information that is, appropriate from the US perspective here. I often get questions about experiences that could be considered political in some way. So for example, working for an abortion provider or union organizing, or similar kinds of activities that might give a reviewer a kind of hint to your political beliefs. I would say, these are not bad experiences. These are often really important experiences. And so it's always going to be your call what you include. But if you're sort of weighing the possibility of including or not including these experiences, I would encourage you to think about what you would like to share about the experience and why, and whether the experience is representative of things that you want to continue doing. So, if it's something that is germane to your goals within your training and your profession in healthcare, then it's something that I think is fair to share with schools, because you want to be sure that you are in a place that's going to support your goals, right? Obviously, if you are somebody who's interested in like providing abortions as part of your career, you want to be at a school where you're going to have access to that kind of training, where you're going to have access to resources to help you kind of become that kind of provider. It's also important to remember that literally any experience could elicit a strong, like, personal response from an application reader. Like, everybody is weird about some things, and everybody irrationally dislikes some things. That's not necessarily a problem. Eliciting a strong response is not necessarily a problem for an application. First of all, because an individual application reviewer is not making decisions for themselves. They're making decisions on behalf of an institution. And so these are folks who are trained and, and who understand that their personal beliefs, their personal, kind of way that they move through the world is not necessarily representative of the institution's priorities. But secondly, because let's say it is the case that person's professional or personal personal preference is representative of the school, would you be happy in that place? Like, if you are in a place that is hostile to a political belief or other kind of core value of yours, is that a place where you can feasibly be trained as a professional? This is also, reasonable to ask. Along the same lines, experiences that can essentially give clues about your identities. Those are also sometimes sensitive subjects, things that sometimes people, debate whether they want to include. And here again, I would say, think about why you're sharing the information. Think about what you're sharing elsewhere in the application that might also give clues to those identities, and whether the experience, the identity, whatever, is important for understanding your perspective as a student or future practitioner. Again, there's no right or wrong answer here, and it's really very much a personal decision what you want to disclose in an application. But these are definitely the things that I would consider. How is it contributing to the understanding of you as an applicant is kind of the central question. When we talk about Most meaningful experiences. Like I said, application services will sometimes give you the opportunity to designate some subset of these experiences as most meaningful. In AMCAS, it's up to 3 experiences, and in ADSAS up to 6. In AMCAS, you get additional space. So you get 1,325 additional characters, so almost twice the space that you get for the baseline description. And this is a space for you to kind of write a mini essay about why this experience was important to you. This is a great space versus the personal statement to really elaborate on a story or a specific kind of memory of this experience that you'd like to develop a little bit more. I think that it's really good when you're choosing most meaningful experiences to try to choose experiences that represent different facets of your portfolio. So not all research experiences, not all clinical experiences, not all leadership experiences, but some combination of experiences that helps the reader kind of see you in a multifaceted perspective. Now, the last thing that I'm going to say, I'm going to preface by saying this is not an absolute, but one of the things that you can consider is whether your letters of recommendation align with these experiences. This is, again, by no means a hard and fast rule, but it's often the case that applicants will solicit letters from people who have observed them and experiences that are really important to them. And so there is sometimes overlap between the activities that you get letters of recommendation from and the activities you're noting as most meaningful. Again, it's not a magic formula, but it's something to kind of keep in mind as you're thinking about your application. For future experiences, it is very important to know that you are only able to list activities that you have at least begun at the time that you submit your application. So if you're submitting your application on June 1st and you're starting a new job on June 15th, you cannot put that new job into your application. However, if you are starting a new job on June 1st and applying on June 15th, then you can include that job. And it's good to know that for AMCAS in particular, you're allowed to estimate future hours for in-progress experiences. So you can use a separate date range to say June 2024 to July 2025, I anticipate this number of hours of this experience. A DIA ADSAS and a COMAS will only accept hours you've completed, so they don't allow you to project hours. You can also use description boxes to clarify future duties if you're kind of including an activity that you're at the start of. And if, let's say, you do submit your application on June 1st and start something new June 15th, you can also typically find opportunities to provide details about ongoing experiences in secondary applications. If anybody out there is, I guess some of our recent grads will have been affected by this, and maybe some of our 2024 grads as well. But experiences that you were undertaking during semesters that were affected by COVID, it's okay to acknowledge that. It's okay for an experience to be shorter than you originally anticipated because of, closures. I think just thinking about, what you were able to learn from that situation. If you started a new experience as a result, you can also include that, even if it was a small commitment or if it was a remote activity. Okay. So having talked about lots of the basics, I want to spend a little bit of time talking about how you actually construct one of these entries, and then we can go through a couple of examples. So I encourage people to start with something like the STAR method, STAR standing for situation, task, action, and result, as a way to get the basics down. So this is an acronym that we use in resume writing as well, but I think that it's really helpful as a framework for kind of creating your experience description, which you'll then, kind of continue to modify. I think it's really helpful if experiences descriptions allow you to focus on your achievements and outcomes rather than tasks that you were assigned. And it can be particularly helpful if you're able to tie your results to organizational goals. So a lot of this is very similar to like kind of writing a set of bullet points for a resume. Although for these experience entries, I do recommend writing in prose rather than in bullet points. So I've got an example here for a research assistantship, and you'll see that like the kind of situation and the the sort of action are described in the first sentence. There are achievements and outcomes that are quantified, that are tied very specifically to the goals of the research group. Kind of what I did, where the research is published, that sort of thing. This is, again, super, super basic, but this is about the amount of space that you have. So this is about 700 characters. And so this is essentially, the level of detail that you're typically looking for in any description. When you're, kind of using something like the STAR method to create your draft, then you can go back and, obviously modify, edit. I think some of my tips here are, number one, try not to rely too much on adjectives. We like I ran an unprecedented number of participants is less helpful to the reader than I ran 200 participants, right? Being as precise as you can in your description, especially if you can use numbers, is really, really helpful. Obviously, you don't need to exaggerate, like your accomplishments are great, so make sure that you're being, sort of true to what actually happened. And think about the appropriate level of detail given the space. So number one, think about what's most interesting for schools and their representatives to know about this experience. And don't focus on minutia. So what I mean by that is, for example, you don't need to list all of the lab techniques. I don't need to see Western blot anywhere, honestly. I mean, you can, but you don't need to say those things because the exact techniques that you used in your research are less important here than understanding kind of what you contributed overall to the research. They're less important than understanding the intent of the research and the overall outcome of the research. So thinking about, from an outsider's perspective, what's going to be most helpful, those are, I think, the kind of places that can help you to figure out what you want to highlight about a given experience. Again, with only 700 characters or 600, depending on the application service, you're not going to be able to say everything about every experience, but you are able to think about what you want to highlight from each of your experiences for admissions personnel to understand. And just with the personal statement, revising these descriptions is key. Paying attention to the content, the structure, the tone, all of that is important because this is writing as well. And so you want to take that seriously. I think it's important to be consistent with punctuation. I always encourage people to use sentences and not bullets. I think it shows more care for your reader if you're writing it in a paragraph form and writing it in a way that is intended to be followed. Do I think that you can be successful as an applicant if you use bullet points? Yes, but I think, and I think that admissions personnel generally really like to see some shaping of the experience from the perspective of the writer. I also encourage you to think about how your experiences are forming the part of the narrative that you want to convey, right? So thinking about the story that you want to tell about yourself as an applicant and how your experiences are indicative of the ways that you've already started to engage with the things that animate you, the things that motivate you to a career in healthcare. The spaces for experiences are also places where you can provide necessary context to help admissions personnel understand your choices, right? So if there was, for example, an abrupt end to an experience, you can address that in the experience description if you think that it would be helpful for admissions personnel to know. Okay, so I want to just do a couple of quick examples. And so what I'm going to do is I'll show you some examples of entries of this kind. I have changed all of the names and identifying details, bonus points to anybody who can figure out what I changed all the names to. You should, kind of on your own, read through and think about what you like, what are the positives of each of these entries, and then any weaknesses or concerns or questions that arise as a result of this specific entry. So I will give you a second to read. We'll just do a couple of these, for example, here, and then I'll go through my kind of reactions to each of these. So I'm going to give you this first one, and I'll give you all a second to read. Okay. Does anybody want to share any thoughts about what they like about this response or any questions they have about this entry? Okay, I'll move on to my thinking. So first, I think a lot of good about this response. Number one, it shows a full academic year of commitment with pretty substantial hours. I love that this is a research entry that uses language that is pretty accessible to non-specialists. That's always one of the comments that I tend to make on these kinds of entries. So using language and kind of framing the comments about the research in a way to understand kind of what are the broader implications. This is amazing. It also, I think, does a really good job of connecting the experience to future interests. And that can be really helpful for a school to understand like where this person is going in the future. The only question that I think this example raises is it's not kind of noted as the most meaningful activity. So there's a question is like, is this not something that is a huge interest, in terms of research moving forward? Again, this is, one entry seen in a vacuum. There could be other research experiences that are noted as most meaningful in the application. And so we don't know, but there's kind of an open question there, I would say. I'm gonna skip this one because it's super long, and I'll give a brief moment for folks to read and think about this one, and then I'll come back and give my thoughts. Okay, so for this example, I think the major positive here is that it shows an interest in and an existing commitment to global health initiatives, which could be really significant if I'm a school who is interested in and provides a lot of support for that. Questions that I have, this is listed as a leadership activity, but the description doesn't focus a lot on the leadership role. And so I'm left kind of wondering why this is the category that was chosen or what else could be said here. There are potentially some concerns about, voluntourism. So going, coming from the US and going to a developing country and, kind of having a short-term aid, although I think there is some degree of addressing that in the response in terms of talking about working with folks who are local to provide services. And the last thing sounds petty, but honestly, it really does stand out when you're reading a lot of these descriptions. The last period is missing. They ran out of characters. It was at 700 characters, but I would rather see you try to save a character somewhere else and have a punctuation at the end because it sticks out. Yeah, okay. So quick examples. There are several more examples in these slides, which I'll share with everyone, but we don't need to go through them all for this evening, so we can save time for questions. But I would say taking a look through them, thinking about them for yourself, and then go to my slides where I kind of note my responses to them, I think can be a really helpful exercise. So some last things to put together before I open it up for any questions. Just remember, it's often a concern for people, like, how do I stand out as an applicant? And what I say over and over again is that describing your experiences in an authentic and, personal way is the best way to be unique as a candidate because nobody else has had your experiences from your perspective. Many of the contours of health professions applications are similar, right? Pretty much everybody who's applying to medical or dental school has had some clinical experience or service experiences, right? But the details in those experiences, what you've learned from those experiences and are taking forward, how those experiences relate to your values as an individual, those are places of uniqueness. And so being able to tell your story through experiences and show admissions personnel kind of what was important to you in each of these is the best way for them to understand you and for them to start to feel a connection with you as an applicant. Again, showing admissions personnel what you care about through how you've spent your time is one of the most convincing things that you can do as an applicant, right? I can say any number of things about what I'm interested in, but it carries a lot more weight if I'm able to connect my goals, my motivations to experiences that I've had or experiences that are ongoing. And using these experiences to help tell your story, right? The personal statement is one place where you're doing some storytelling, but your experiences taken together are also a part of that story. That's really, really important. Some like thoughts as you're putting things together. Make sure that you're taking care with technical language, especially about research. As I said just a minute ago, I am always so excited when I read a research entry and I feel like the language is completely accessible to me. I'm a pretty educated person, but I'm not a specialist in everything by any stretch of the imagination. And your audience is going to be highly varied. There are going to be some people who are physicians who are reading these applications, but there are also going to be people from other academic and professional backgrounds who are part of admissions committees. Even if a physician is reading your work, like if you're doing basic metals research in a chem lab, that's not necessarily going to be accessible to a cardiologist. And so helping the reader understand what your research means, and in any other place where you might be using technical language, what this experience means for you is crucial. If you are talking about clinical experiences and you're bringing up patient details, my advice is the same as with the personal statement. You can use details de-identified. So, Mr. X or Susie, when that's not the patient's actual name, but use them with care, right? Only share what you need to make your point. That means if you don't need to provide all of the details of someone's illness in order to get the point across, then you shouldn't. You should, leave their history to them, right? If you don't need to be specific about exactly what brought them into contact with the healthcare system to make your point, then don't. It's also really important to be careful of any language that even could be construed as condescending or judgmental. Make sure that, you are really taking to heart that you have not walked in those patients' shoes, and that what you are writing shows respect for the patients that you're talking about as your teachers. If you're writing about a patient in your application, you've learned something from that person, and making sure that you are that you're giving that dynamic the respect that it deserves is really important. If you're writing about an experience that has any kind of a negative valence, try to present it in a way that is oriented more towards solutions rather than just kind of bemoaning problems. it's really, really easy to get frustrated by, especially, living here in the US, by our healthcare system and how big and bureaucratic and not attuned to the needs of individuals that system is. But I would say, if you're talking about that, trying to think about like what it is that you want to do to contribute to making things better. And remembering not to overgeneralize, recognizing you're at the beginning of your understanding of your intended profession. And so making sure that any comments that you're making, any judgments that you're making and writing about are well-founded and kind of appropriate to the experience that you've had so far. Okay. So that's all of the presentation, and I'm happy to open it up for questions. If anyone has any, you're welcome to put questions in the chat and or raise a hand, use your microphone, etc. Thanks, Ariana. Priyanka, any questions? All right. Chill. Thank you guys for being here. Really appreciate it. Thanks to everybody who's viewing this recording later. I am around. If you have questions, you can let me know. I'm happy to take a look at representative entries. I cannot commit to doing 15 for everybody, but if there's one that you're working on and you feel like some feedback would be helpful, you know where to find me. All right. Thank you all so much. Have a great rest of your evening. Looking forward to working with you this summer.